talk about a general treatment approach to obesity. And if we think about obesity as a chronic disease, just like anything else, say high blood pressure or even asthma, then we can really get our minds around what our approach here is with the condition of obesity. So with asthma, we might want to think about lifestyle changes. And somebody's wheezing. If you had asthma and you go to your doctor, we'll say, okay, well, let's make sure we're dusting everything, get rid of the cat. And if that's not working, do you want to go to some more extreme thing like move to Arizona where the humidity or heat or whatever helps the asthma? So that would be quite extreme. Or maybe we step it up here. You got rid of the cat, which was really awful, but still having wheezing. Then we have medications, and we can add medications thinking about the risks and benefits of each one. An inhaled steroid, something that dilates the lungs called a bronchodilator. And if we're really having trouble, we might want to step it up with oral steroids, which has significant risk to them, but it's trying to resolve that symptom of asthma. And if still problems are going on, we can now step it up even higher to other agents called biologics to really suppress the immune system. Higher risk, but greater benefit in the right situation. So thinking about obesity, we also have these different areas we can look at. Lifestyle. And lifestyle is something, whether you're living with weight or not, is something we should all be working on and trying to maximize and benefit, because it does affect our sense of well-being. And that can be really implemented through behavior change. For some people, behavior change is okay. They get an app, they change their diet, they never look back. Things are good, they start an exercise program, they feel great, and they just keep going. But most of us mortals have a lot of difficulty with behavior change, some more than others. There's a lot of social aspects of that, like what's going on in life, but there's also probably a fair bit of genetics and how our brains are wired. So we have lifestyle, nutrition, movement, sleep, stress reduction. There's different tools there that you can kind of dig in on. And that's really the foundation, as it is with most other chronic diseases, is focusing on those aspects, like with the asthma, cleaning up the house, reducing the dust, and so forth. Then we have medical therapy. Knowing that the deep brain is the site of obesity, we actually have drugs that can go and interact with those areas of the brain to bring down body weight when lifestyle doesn't quite get us there. And third, the other clinical tool I want patients to know, and this is when there's criteria for it, is considering bariatric surgery. Many clinicians are shy to bring up that topic. I think it's a lot to do with bias. So bariatric surgery, when I first bring it up with people, there's often a knee-jerk reflex like, "Ooh, that seems really extreme," or "that seems like a last resort." But I often ask, if you had a gallbladder issue with a stone in it and it was causing symptoms, the right surgery would be to take that gallbladder out. Well, bariatric surgery is often the right tool or the best tool to resolve symptoms of obesity. And we'll talk about, for certain individuals, criteria, just quickly, BMI over 35 plus health complications, or a BMI over 40. We know from a bird's eye view on a population level, symptoms of obesity are much improved in those that go through surgery than those that are treated with medical management and lifestyle. So anyway, these are the tools to consider. I think of them as your tools, and we'll go into more depth on each of these, but we're talking about lifestyle, medications, consideration of surgery, with this backdrop of thinking about our minds and how habits are formed and how we can navigate that to shift things in our favor.